Hello, everyone. My name is Lenise Joseph, and today I will be walking you through the process of conducting a therapy session. The main objectives for this presentation are the need for therapy, the process of preparation, conducting therapy in its 5 stages, and the follow-up process. By the end of this presentation, you will have learned how to identify the needs for therapy, how to prepare for a client's arrival, the 5 stages that make up the therapy process, as well as what takes place during each stage, and the process of following up with a client. There are many circumstances that cause one to seek out professional help. Whether by choice, recommendation, or referral, therapy aids with addressing issues and concerns, the decision-making process, marital and family problems, the management of stressful life events, coping with health issues and physical disabilities, mental disorders, and ongoing difficulties. And these are the needs for therapy. There are several different needs that somebody else might come to therapy, but these are just basics of some of the ones that you might see. Preparing for a session. How a practitioner prepares for a therapy session varies. However, there are 3 components to consider when prepping. The first one is competence. That code of ethics requires practitioners to continuously strive to increase their professional knowledge and skills and to apply them in practice. To prepare for the session, practitioners are encouraged to learn more about the client's issues and gain an understanding of the client's race, culture, and background. This can be attained by reading books on it, workshops, and relationships with others who are from that culture, as well as conversations with them. Physical preparations requires creating an atmosphere that is conducive to work with the client. Practitioners should consider their office setup, the wait area and buildings, how they are arranged, the supplies needed to conduct the session, barriers that would deny access and accommodations available to various conditions. So this could be anything from those who are blind, those who are disabled, those who can't access it by walking it, whether they need a wheelchair ramp. All of those things should be considered when preparing for a therapy session. We do not want to be offensive. We want to make sure that there is ways and avenues for all parties involved. Mental preparation involves doing whatever is necessary to put aside possible distracting thoughts and getting ready to fully focus on the client. Some examples of this may be prayer, meditation, walks, moments of reflections, and doing a checklist of things that you need to get done, whatever it is to take your mind off of anything but focusing on the client. Another form of mental preparation is mindfulness meditation, which involves maintaining undistracted thoughts, being non-judgmental, and awareness of moment-by-moment experiences, meaning that every person that comes in, they are all different on how they handle different things. So you want to be mindful that not everybody there could be several different people who go through the same situation, but they all handle life differently. There are 5 stages of the therapy process. Henke and Cornier proposed a 5-stage model for defining the counseling process through which both counselor and clients are moved. The 5 stages are of the following: 1, relationship building; 2, assessment and diagnosis; 3, formulation of therapy goals; 4, intervention and problem solving; and lastly, 5, the termination and follow-up process. Okay, starting off with stage 1, it is the relationship building. During this stage, the practitioners and clients they getting acquainted. First impressions play a vital role as the determining factor for continuing the counseling process. Practitioners must be aware of their body language, facial expressions, eye contact, and tone. These are all part of active listening. They must display acceptance, kindness, and understanding of one's emotions, thoughts, and behavior. These are included in the empathy and warmth, being accepting and not being judgmental, making the client feel welcomed and understood. Expectations for therapy are discussed and boundaries are established. This happens when explaining to the client what the boundaries are for the relationship, what's going to be expected in the meetings. things of that nature, all of the contracts and things of that nature. When these things are done, trust is built, which in turn builds a rapport with the client. This is how you build a relationship with them, an ongoing relationship where they can safely trust in you and tell you different things based off of their first perspective with you and their first encounter with you, and following these rules as well as ethics. Stage 2 is the assessment and diagnosis. During this stage, you're going to gather information, you're going to observe, identify strengths, issues, and patterns. So during this phase, the practitioner actively listens to and gathers information from the client regarding their reason for attending therapy, their family's history, work and home life, education, and other necessary factors. Practitioners should observe the client's behavior, tone, their volume, their body posture, and facial expressions to further assist with the data of their assessment. And then based on the data and based on the data that's collected and the patterns that are identified and diagnoses are made. So it's not only for the client to make sure that we're watching for their body parts and their body postures. As the practitioner, we need to make sure that we are considering those things of our own as well. But this also helps you gather for your assessment, how they're speaking, how they're talking, things of that nature will kind of give you an idea of where they are at and what they need help and assistance with. Stage 3 is the formulation of therapy goals. And this is collaborative work, identifying desired outcomes, developing achievable goals, and creating action plans. So during this stage, both the client and the practitioner come together to discuss, identify, and establish realistic, achievable, and measurable goals for the client. The Code of Ethics, Section 101, requires that these goals are always in the client's best interest. Not only are the client's goals established during this stage, but the framework on how to obtain them, the action plan to carry them out is considered during this process as well. So we're not just giving the client a list of all of these goals that we want them to reach. And not only that, you're going to be considerate of what they see as a goal. You're going to talk to the client and see what they see as an end-time goal, something that they would like to see in their life. Remember, the client is the expert when it comes to dealing with them, and we are just assisting. Stage 4 is intervention and problem solving. During this stage, the problem that were identified in the previous steps are solved by implementing the course of action chosen by the practitioner and the client. The client and the practitioner meet to monitor and evaluate the effectiveness of the plan. Questions like, does it work? How do we know it works? Are considered. If and when the implemented plan is not effective, adjustments are made. So during this process, the client and the practitioner are watching to see how their action plan is playing out. If it's causing them to achieve the goals, that is the determining factor of whether or not what they implemented is effective. And if it is not, they will go back and make adjustments where need be, the ones that are not being effective. It also creates them for future clients as well, whatever structures that they may have been implementing. If it's not working, it is something for them to consider for future clients as well. And they are responsible for it. Stage 5, the last and final stage, is termination and follow-up process, where there is a planned ending, a review of progress, addressing concerns, contacting the client, and additional support. So termination is the last and final stage in the therapy process. It is the end of the social work client relationship, and the ending of the practitioner client relationship should be carefully and skillfully planned out prior to the actual termination. Practitioners are required to review the progress that the client has made over the duration of the therapy, encouraging and preparing them to make informed decisions on their own going forward. Clients are given time to express any concerns and emotions that they might be experiencing ending the relationship. So sometimes they might have anxiety, they might feel like they're not getting it, or they're scared of being on their own because they have been working with you. So we must be considerate of the client's feelings and giving them access and a chance to express any concerns that they may have or any emotions that they might be experiencing as they are getting ready to end the relationship. And we don't want it to be abrupt. We want it to be well planned out, well thought of, and talked and discussed prior to terminating them. Once the client has been officially terminated, practitioners will reach out to check out their progress, see how they are doing. There are times when a client may need additional assistance and support. So we might have to give them a referral or point them to resources that are needed. So there are times during the follow-up process where you're checking to see how they're doing, and you might need to be a bit of assistance even more after the termination process. Lastly, the key features of therapy, they're going to be working relationships, warm and empathetic approach, setting goals, modifying behavior, and empowerment. While there are many aspects that contribute to the therapy process, the key features are the following: working relationships, creating and establishing a trusting relationship is crucial for the entire process with the client. Warm and empathetic approach. This is making sure that the client feels accepted and understood, and it opens up them to share their feelings and their thoughts during this process, being accepting and making them not feel judged and understood. Setting goals provides both the client and the professional a map to the desired outcome, like we talked about in the first few slides. When we're setting these goals, not only are we just coming up with goals, but we're looking out for the framework, and there is a map to how to get to that desired outcome. Modifying the behavior. Therapy assists the client with changing their unhealthy behaviors and patterns. This comes after, once we've identified what their unhealthy behaviors are and how we want to modify and fine tune them. And lastly, empowerment. Empowerment develops the client's skill and confidence to make informed decisions and manage their life challenges going forward individually. So the end goal is to get them to a place where they can make informed decisions for their life. Again, my name is Lanice Joseph, and thank you so much for watching my presentation on how to conduct a therapy session.